general practitioner in southwest London, and I've been a GP here for about 20 years, and I'm the joint clinical lead for Sutton Clinical Commissioning Group, which was established with 3 groups coming together in November 2011. Our vision for our CCG is that the patient is at the heart of a concentric ring of care, providing the patient's needs in terms of medical needs, mental health needs, physical needs and social needs, so that all the agencies providing these various bits of care are patient-focused, integrated, and are orchestrated by us as local GPs who are leading the commissioning group in the new NHS. Our hopes for clinical commissioning are really the government's hopes, I suppose, that because GPs are close to patients, they're trusted by patients, they have a second to none view of the local scene. They know what works well and they know what works not so well. So we hope that as local GPs, on behalf of our patients, we will be able to commission all those services that they require, and that we're able to marry up our local needs with the inevitable regional, strategic and national requirements that the NHS will give to us. We also want to make sure that patients have what we call effective care pathways, that patients just don't go to outpatients or inpatients, that in fact if they have, especially if they have long-term conditions like COPD, chronic obstructive pulmonary disease, then there's a whole care pathway for the patient that's well designed, well understood, so that if things go wrong with the patient's health or well-being, people know what should happen to them, and above all, the patients and their carers know what should happen to them. So care pathway redesign and improvement is one of our priorities. And as well, that hospitals give the right care in the right place, high quality care is maintained, but that the patients have a good patient experience at the end of it. It's no good if they have a hip replacement or a hernia repair and they say, well, it went okay, but this happened and they lost my dentures and this kind of thing. It's really important that the patients have a good patient experience as well as high quality services. Our priorities as we move towards authorisation and beyond are principally to keep a financial grip on things. Our PCT's in its 2nd year of turnaround, and we've been working very hard with the PCT to bring in financial balance to make sure that we can live within our means. So that's involved a lot of work about making efficiencies, and this is something that's absolutely a priority for this year and for next year and beyond. It's very important that we keep our practices engaged. So far they're mostly quite excited and attend very well at our workshops. We've had 3 in the last month with very good attendance. It's very important that we keep them on board, that we explain everything we're doing, that we really make sure they realise this is a membership organisation. We're only the sum of our parts, and they're a very important part of us. Transition. During this massive NHS reorganisation, it's very important that it's a safe transition, that all the things that the NHS should be doing is doing, that we don't forget to look at things in terms of quality and safety, and that work streams carry on through to the new world. Two further priorities for us are: 1, our local NHS hospital does not so far have an agreed route to becoming a foundation trust. That's an acute priority that's just been presented to us this week. And finally, urgent care redesign. Our local hospital has a new urgent care centre. This is a phased approach, and it's really important that we get our urgent care reforms right and sustained. The main challenges over the next few months are mainly to do with finances. We, like all NHS organisations, have to work with what's called the QUIP, which stands for Quality, Innovation, Prevention and Productivity. And the productivity challenge is that we have to make big cash efficiencies, both as provider spend and also for our hospital spending. That's a big, tough ask. We've worked hard at it these last few years and we need to continue with that. We need to also make our CCG work with a lot less staff than PCTs previously employed to do the same kinds of things. Not entirely the same things, but many of them. So that's a challenge. And as well, we have to make sure that urgent care and out of hours care works. We have to procure a new 111 service. This is the sort of service, a bit like the police's 101 service. The 111 is going to be a healthcare line where it's urgent but not quite 999 level. We have to procure that for our area. And we also have to procure a new out-of-hours service for GP services out of hours. So that's really very important to us and very important to our patients. So they're big priorities and challenges for this next period. What benefits will patients see? Well, I hope they certainly won't see any change or diminution in service. I think they'll benefit because some of the layers of NHS bureaucracy will have been stripped away. They'll see it as very much a local service. In the London Borough where we are, we will now have a local public health department, a local health watch, local CCG, and local individual funding decisions. And I do hope that where we have commissioned a new service, that's probably going to be an out-of-hospital service, a community service, that it will be sustained on a longer term than we've been able to manage when we've had to work with the whole PCT economy. So I hope patients will see that there's no diminution in service. I hope patients will see that the NHS is local, it's lean, and that their voice and view matters.